Dear students, myself Deepa here. Through this slide, I am discussing about uric acid. Uric acid is the end product of purine metabolism, or uric acid is the catabolic product of purine. The high amount of uric acid in our body that causes gout is a major clinical condition. And other disorders, Leishmanian syndrome and other metabolic disorders are participated by the increasing amount of uric acid. Uric acid increases called hyperuricemia and uric acid decreases called hyperuricemia. The structure of uric acid. Uric acid is a heterocyclic compound of carbon, nitrogen, oxygen and hydrogen. With the formula 5 carbon atoms, 4 hydrogen atoms, 4 nitrogen atoms and 3 oxygen atoms. Uric acid is a heterocyclic compound consists of 5 carbon atoms, 4 hydrogen atoms, 4 nitrogen atoms and 3 oxygen atoms. Uric acid forms ions and salts known as urate, acid urate, and finally it is an ammonium acid urate. Uric acid is the product of the metabolic breakdown of urine nucleotides. Uric acid is a product of the metabolic breakdown of urine nucleotides, and also we can say that uric acid is the catabolic product of urine, and it is a normal component of urine. Uric acid is a normal component of human urine. Increasing blood concentration of uric acid that leads to gout. It is a serious condition, and other medical conditions also associated with uric acid, including diabetes and the formation of ammonium acid urate in kidney stones. We already know that the condition gout, then diabetes and kidney stones, a painful condition, and the formation of ammonium acid urate that leads to kidney stones. Uric acid first isolated from kidney stones in 1976 by Carl William Seeley. Uric acid displays keto-enol tautomerism. Uric acid displays keto-enol tautomerism, and so also say that it is lactam-lactine tautomerism. Uric acid displays keto-enol tautomerism or lactam-lactine tautomerism. Uric acid is a diprotic acid with a pKa1 is equal to 5.4 and pKa2 is 10.3. That at the physiological pH, it predominantly exists as the monoionic urate ion. Uric acid at the physiological pH exists as monoionic urate ion. Monoionic urate ion with the pKa1 value is 5.4 and the pKa2 value is 10.3. The solubility of uric acid in water is very low. All these salts exhibit greater solubility in hot water. This low solubility is significant for the etiology of gout. Gout is a monosodium urate crystal deposited in synovial fluid of the joint. The major reason behind is uric acid is less soluble in water. Major reason behind gout is the uric acid is less soluble in water. The uric acid formation. Major enzyme participating in the uric acid formation is xanthine oxidase. The actual reaction is hypoxanthine is converted to xanthine, xanthine is converted to uric acid with the help of the enzyme xanthine oxidase. The xanthine oxidase is a large enzyme whose active site consists of the metal molybdenum bound to sulfur and oxygen. The active site of the xanthine oxidase consists of the metal molybdenum bound to sulfur and oxygen. Xanthine oxidase is a large enzyme and its active site consists of molybdenum bound to sulfur and oxygen. Uric acid is released in hypoxic condition. That means no oxygen saturation. Uric acid is released. In human blood plasma, the reference range of uric acid is 3.4 to 7.2 milligram per 100 ml for men, 3.4 to 7.2 milligram per 100 ml or milligram per deciliter for men, and 2.4 to 6.1 milligram per 100 ml for women, 2.4 to 6.1 milligram per 100 ml for women. An individual can have serum values as high as 96 milligram per liter or 9.6 milligram per deciliter. Not how gout humans. About 70% of daily uric acid disposal occurs via the kidney. 70% of the daily uric acid disposal occurs via kidney. In 5 to 20% humans, impaired renal excretion leads to hyperuricemia. Impaired excretion leads to hyperuricemia in 5 to 25% of humans. Normal excretion of uric acid in the urine is 250 to 750 milligram per day. Normal excretion of uric acid in the urine is 250 to 750 milligram per day. Uric acid concentration above the normal is known as hyperuricemia and uric acid concentration below the normal is known as hypouricemia. Above the normal is known as hyperuricemia and below the normal is known as hypouricemia. Uric acid concentration in urine above the normal is known as hyperuricosuria and uric acid concentration in urine below the normal is known as hypouricosuria. Uric acid levels in saliva may be associated with blood uric acid level. Hyperuricemia or increasing uric acid level which induces gout. There are various potential origins for gout. Diet may be a factor. High intake of dietary purine, high fructose corn syrup and table sugar can increase levels of uric acid. High intake of dietary purine, high intake of sugar can increase levels of uric acid. Serum uric acid levels can be elevated by reduced excretion. Fasting or rapid weight loss can temporarily elevate uric acid level. Fasting or rapid weight loss can temporarily elevate uric acid level. That means some diet temporarily elevate uric acid level. Certain drugs such as thiazide diuretics can increase blood uric acid level by interfering with the renal clearance. Some drugs interfere the renal clearance. That's why uric acid level may increase in blood. That is hyperuricemia will occur. Gout, the deposition of monosodium urate crystals, the synovial fluid of joints that causes gout. Excess blood uric acid can induce gout. It's a very painful condition resulting from needle-like crystals of uric acid precipitating in joints, capillaries, skin, and other tissues. The enzymatic defect and various other reasons for gout will discuss in the next topic. Tumor lysis syndrome. What is tumor? It's an excessive proliferation of cells. Tumor lysis syndrome, an emergency condition that may result from blood cancer. Tumor lysis syndrome is an emergency condition that may result from blood cancer and produces high uric acid levels in blood. When tumor cells release their contents into the blood, either spontaneously or following chemotherapy. Excessive proliferation of cells. More amount of cells are produced in tumors. That more amount of cells, more amount of DNA, more amount of RNA. The cell turnover will occur that leads to excess amount of urine and excess amount of hemoglobin. This excess amount of urine catabolized to form uric acid. These conditions occur in blood cancer and also following chemotherapy. Tumor lysis syndrome may lead to acute kidney injury when uric acid crystals are deposited in the kidney. More amount of uric acids are produced and that more amount of uric acid deposited in kidneys and will produce acute kidney injury. Leishman syndrome, the rare inherited disorder associated with a high serum uric acid level. This disorder is due to defective enzyme HGPRTS. HGPRTS means hypoxanthine guanine phosphoribosylate transferase enzyme. It is an enzyme in salvage pathway of urine that will discuss later. In this condition, a self-mutilating behavior is occur. Self-mutilating behavior and also spasticity, involuntary movement, and cognitive retardation as well as manifestations of gout are seen in this syndrome. Hyperuricemia may increase risk factors for cardiovascular diseases. Hyperuricemia may increase risk factors for cardiovascular diseases. Hyperuricemia may be a consequence of insulin resistance in diabetes rather than its precursor. Hyperuricemia or excess amount of uric acid can cause insulin resistance. Some studies showed that high serum uric acid was associated with a high risk of type 2 diabetes. High risk of type 2 diabetes that is independent of obesity, dyslipidemia and hypertension. Serum uric acid was associated with a high risk of type 2 diabetes. Hyperuricemia is associated with the components of metabolic syndrome. Hyperuricemia is associated with components of metabolic syndrome, including in children. One cause for hyperuricemia is one cause for metabolic syndrome. Kidney stones can form through deposits of sodium urate microcrystals. Kidney stones form through the deposition of sodium urate microcrystals. Saturation levels of uric acid in blood may result in one form of kidney stone when the urate crystallizes in the kidney. Before we discuss about the uric acid solubility. Uric acid is less soluble in water. Uric acid is less soluble in water, so increasing amount of uric acid level that increase the crystallization of kidney stone formation. These uric acid stones are radioluminescent and so do not appear in an abdominal plain X-ray. These uric acid crystals do not appear in abdominal plain X-ray. Uric acid crystals can also promote the formation of calcium oxalate stone, acting as seed crystals. Uric acid crystals can also promote the formation of calcium oxalate stone. Formation of calcium oxalate stones acting as seed crystals. Acting as seed crystals. Low uric acid, that means the hyperuricemia, can have numerous causes. Low dietary zinc intake cause lower uric acid level. This effect can be even more pronounced in women taking oral contraceptive medication. That means low dietary zinc intake causes lower uric acid levels, and also women taking oral contraceptive medication that decreases uric acid levels. Zavalamer, a drug indicated for prevention of hyperphosphatemia in people with a chronic kidney failure, can significantly reduce serum uric acid. Serum uric acid levels decreases in patients with a multiple sclerosis, that possibly indicating a diagnostic marker for multiple sclerosis. Hyperuricemia is a diagnostic biomarker for multiple sclerosis. Normalizing low uric acid or normalizing hyperuricemia. Correcting low or deficient zinc levels can help elevate serum uric acid. Correcting low or deficient zinc levels can help elevate serum uric acid.